Most seniors have been told the same thing for years. If your back hurts, just keep moving and walk it off. But what if that simple advice is not only incomplete? It is the very reason your back pain has not improved and why your risk of falling and losing independence is quietly getting higher after 60. You have probably heard that any exercise is good exercise. Today, as Dr. Robert Ellis, after more than 20 years working in geriatric medicine in the United States, the message is very direct. Many older adults are not in pain because they are lazy or weak. They are in pain because they have been doing the right idea in the wrong way for too long. Most seniors do this exercise wrong. Not just one exercise, but the whole way they think about moving with back pain. They walk, but never warm up. They push through sharp pain. They rush through movements without breathing. They never rest, and then they blame their age when the pain gets worse. If you are over 50 and you have ever told yourself, "My back hurts because I am old," stay with this video. By the end, you will understand the 5 most dangerous exercise mistakes seniors make with back pain and how to fix each one in a safer, smarter way that actually protects your independence. Before giving any advice, let's start with what the research shows, not just opinions. A 2022 review on aging, sarcopenia, and falls found that resistance training, when done correctly, is one of the most effective ways to maintain muscle, reduce fall risk, and support independence in older adults. At the same time, large studies on back pain in older adults show that doing nothing or doing only light walking when your back is already weak does very little to rebuild the strength and balance you need to stay safe. One analysis of fall prevention programs in seniors reported that structured balance and strength training could reduce falls by up to 30 to 40% compared to usual activity. So the science is clear. The body after 60 still responds very well to movement, but it responds best to the right kind of movement, with warm-up, controlled strength work, conscious breathing, and respect for pain signals. Not just more of the same rushed or careless exercise you did in your 30s. The enemy here is not you. The problem is the system of quick tips and one-line advice older adults have been given for decades. You were told, just walk more, without anyone explaining that walking alone does not rebuild the deep muscles that support your spine, especially if you already have back pain. You were told, no pain, no gain, by fitness culture that was built for younger bodies, not for a spine that has carried you for 60, 70, or even 80 years. You were sold gadgets, trackers, and fancy shoes that count your steps, but almost no one taught you how to warm up, how to breathe, or how to recognize the difference between safe effort and dangerous pain. This belief that any movement is good if you just keep going benefits the fitness industry, not necessarily your back or your independence after 60. Today is not about blaming you. It is about stepping outside of that system together and choosing a smarter, safer way to move so that every step you take starts to protect your spine instead of slowly wearing it down. There is a hidden condition behind many cases of back pain in seniors that almost nobody talks about clearly. This condition is called sarcopenia, the gradual loss of muscle mass and strength that comes with aging. Sarcopenia does not usually show up as pain at first. It shows up as slower steps, heavier legs, needing your hands to push off the chair, or feeling tired after standing at the sink for just a few minutes. Long before you feel sharp pain, sarcopenia quietly makes the muscles that protect your spine weaker. That weakness then turns simple daily actions, walking on uneven ground, getting out of the car, bending to pick something up, into risky events that can trigger back pain or even a fall. So when you do exercise the wrong way on top of already weakened muscles, the risk grows. Rushing, skipping warm-ups, holding your breath, or pushing through sharp pain do not just cause discomfort in the moment. They feed a cycle where pain, weakness, and fear of movement slowly steal your independence. Over the past 20 years, many orthopedic surgeons, physical therapists, and geriatric specialists have shifted the way they prescribe exercise for older adults with back pain. Instead of only recommending rest or general walking, more and more specialists now emphasize structured strength training, proper warm-up, balance work, and pain-aware pacing as key tools to protect the spine. Orthopedic surgeons are now recommending progressive resistance exercise and balance training because they see who recovers best after spine surgery or serious falls. It is rarely the person who only walks. It is the person who learned to move with control, strength, and respect for their limits. Geriatric clinics and fall prevention programs around the world are building routines that combine gentle strength, balance, and breathing, not endless cardio. So this video is not asking you to believe just one doctor on YouTube. It is inviting you into the same principles that hospitals, rehabilitation centers, and long-term care teams are using every day to help older adults stay mobile and independent longer. It sounds simple and even healthy. I walk every day, so I am doing enough for my back. Walking is good for your heart and your mood, but by itself, it is often not enough to rebuild the deep muscles that stabilize your spine, especially after 60. Biomechanically, walking uses your legs and hips in a repetitive way, but it does not fully challenge your core and back muscles through a range of motion with resistance. Over time, this means you can have a high step count, but still have weak trunk muscles and poor balance, which are exactly what protect you from falls and sudden twists that cause back pain. A narrative review on resistance training in older adults shows that strength work, even simple bodyweight exercises, can significantly improve muscle mass, strength, and reduce fall risk, something walking alone does not consistently achieve. If you rely only on walking for your back workout, you may feel active, but still be quietly losing the strength that keeps your spine safe. How to fix it? Keep your walks, but add 2 or 3 short sessions per week of gentle strength exercises for your legs and core, such as chair squats, seated knee extensions, or supported hip hinges. Think of walking as circulation and mood support, and strength practice as your real back pain exercises for seniors. This combination is far more powerful for back pain and independence than walking alone, and it is much closer to what specialists use in fall prevention programs. The second big mistake is skipping the warm-up. Many older adults go from sitting in a chair straight into deep stretches, twisting movements, or even floor exercises for the back. As we age, joints become stiffer, circulation is slower to respond, and muscles need more time to wake up. When you start cold, your muscles and tendons are less ready to handle load, which increases the chance of strain, spasm, or sudden sharp pain in the lower back. Guidelines for older adult exercise emphasize at least 5 to 10 minutes of light movement, such as marching in place, gentle heel touches, or hip circles, before any strengthening or stretching. One program that successfully reduced fall risk in seniors built every session around a structured warm-up, then balance and strength work, then a cool down. How to fix it? Before you try any back pain exercises after 60, spend a few minutes marching on the spot, rolling your shoulders, and gently tilting your pelvis while standing or sitting. The goal is not to get tired, but to feel your body temperature rise slightly and your joints move more freely before you ask your spine to do more challenging work. A proper warm-up might feel too easy, but it is one of the simplest ways to make your exercise safer and more effective for your back. The third mistake is treating back exercises like a race. Many seniors move quickly through repetitions just to finish the set, especially with familiar moves like chair squats or standing leg lifts. When you rush, your body cheats. You use momentum instead of muscle, your posture collapses, and your brain does not get a chance to practice balance and control, all of which are crucial for preventing falls. Research on balance-focused exercise circuits in older adults shows that controlled, deliberate movements improve strength, postural stability, and quality of life while reducing fall risk. Fast, jerky movements, especially when you are tired, do the opposite. They increase wobbling, missteps, and the chance of straining the lower back. How to fix it? Choose 2 or 3 simple moves. For example, a slow chair squat, a supported hip hinge with hands on the counter, and a gentle standing march holding the back of a chair. For each movement, count 1-2 on the way down and 1-2 on the way up, breathing slowly. And stop the set as soon as your form breaks or your balance feels shaky. Think of each repetition as a small balance and control lesson for your brain and spine, not a number to rush through. This mindset turns your routine into true back pain exercises for seniors that also protect you from falls. The fourth mistake is forgetting to breathe. When movement feels difficult or when pain is present, many older adults naturally hold their breath and brace their entire body. A gentle amount of bracing can support the spine, but when you hold your breath and strain, pressure builds inside your abdomen and chest. This can increase blood pressure, create dizziness, and make the back feel tighter and more painful instead of supported. Guides for lower back exercises often recommend engaging the core while maintaining steady breathing, not breath holding. Clinical programs for older adults teach a simple pattern: exhale during effort, inhale during return. For example, breathe out as you stand up from the chair. Breathe in as you sit back down. How to fix it? Before each set, take a slow breath in through the nose and out through the mouth to calm your system. As you perform a movement, quietly say out in your mind during the hardest part and in during the easier part, using your breath as a built-in rhythm. This small change reduces tension, protects your blood pressure, and allows your muscles to work without locking up around your spine. Over time, breathing with your movement can make your back exercises feel safer, calmer, and more effective. The most dangerous mistake is pushing through sharp or worsening pain, especially in the lower back. Many seniors have been taught to tough it out, to keep going even when the body is clearly saying something is wrong. Studies on older adults with back pain show that fear of movement and avoidance can be harmful, but so can ignoring serious pain signals. Pain that is sharp, sudden, radiates down the leg, or gets worse with every repetition is not the same as mild muscle fatigue. It can be a sign of nerve irritation, joint overload, or a movement that is simply not right for your body. Long-term, forcing yourself through these signals can increase inflammation, worsen mobility, and raise your risk of a fall because the body starts to move unpredictably to protect the painful area. Falls are one of the leading causes of loss of independence in older adults, and back pain that changes the way you walk or stand is a major contributor. How to fix it? Use a simple rule. Mild, dull discomfort that eases within a few minutes after you stop is usually acceptable. Sharp, shooting, or increasing pain is your cue to stop, modify, or skip that exercise. If a movement repeatedly causes pain beyond a 3 or 4 out of 10, even when done slowly and with good form, talk to your physician or physical therapist before continuing. Listening to your pain is not weakness. It is one of the most powerful safety checks. You have to protect your spine, your balance, and your independence. You may notice that these mistakes move from comfort to survival. Starting with only walking is about comfort. Skipping warm-ups and rushing through movements start to affect function. Holding your breath and pushing through serious pain can directly influence your safety, independence, and even your long-term health. Research on functional training in older adults shows that when strength, balance, and breathing are trained together, people do not just feel less pain. They move with more confidence, have fewer falls, and remain independent longer. In other words, the way you exercise today is not only about flexibility or fitness. It is about whether you can get out of a chair without help, climb stairs safely, and live in your own home on your own terms. So correcting these 5 exercise mistakes is not a small detail. It is part of protecting your future self, the version of you who can still bend, reach, and walk without fear that one wrong move will finish your back. This video is not really about exercise. It is about keeping the simple freedoms that matter most after 60 and 70. When you learn to warm up, move slowly, breathe, and respect pain, you are not training for a race. You are training to get out of bed without wincing every morning, to stand at the kitchen counter long enough to cook a meal, to walk across a parking lot without worrying that your back will catch and your legs will give out. You are training to pick up a grandchild safely, to get in and out of the car, to reach a shelf without grabbing the wall for support. You are training to live independently, to use the bathroom, dress yourself, and move around your home without needing someone to hold your arm every time you stand up. This is what real back pain exercises for seniors are about. Not a perfect body, but a body that lets you keep making your own choices. So here is the invitation, not a command. You do not have to fix every mistake overnight. Start with just one change. Maybe this week, you add a 5-minute warm-up before your walk. Maybe you slow down your chair squats and breathe out every time you stand. Maybe you finally give yourself permission to stop an exercise that causes sharp pain instead of blaming yourself for being weak. Your future self, the one who stands up with less fear, walks with more confidence, and stays in their own home longer, will quietly thank you for these small decisions. Age will always bring change, but it does not have to steal your strength or your independence as quickly as many people believe. This is Dr. Robert Ellis, and if this video helped you see your back pain and your exercise routine differently, consider liking this video and subscribing so more people over 50 can find safe, realistic guidance. In the next videos, we will walk through specific safe back exercises after 60, step by step, so you can practice along at home and feel the difference in your own body. You are not too old, you are not too broken, and you are not behind. You are simply ready to move differently.